Good morning. We are back, Health Human Services, today's Wednesday, February 11th. We are now taking up H 660 and doing markup. So Judy, can you join us?
Morning,
Good morning.
Katie McLean, Office of Legislative Council. I'm not logged into Zoom yet.
So do we have a new draft or we do?
Yes. It should be 2.1. Section 1 of that draft has no changes. But the Department of Health provided, there's my link. Some reversion language, and that is what the additional sections are.
And folks, I think you all got an email yesterday. Teresa forwarded the language from Shayla based on some of their analyzing the rural health transformation grant and what's possible within that money. They requested some changes to the opioid settlement funding, and the new version incorporates those changes, correct? Katie?
Sorry, yes.
Yes, okay. So what we're gonna be reviewing, and I'd like us to kind of make decisions on funding amounts if possible today, because we do have the two recommendations from OSAC and the health department that are slightly different. So as we're kind of going through, first maybe we'll review the changes from the health department. And then we'll go through and Katie, maybe then we can do each section and then we can have a quick discussion about if whose dollar amount we're in agreement with and look at the discrepancies.
Okay. Yeah, I have it pulled up. So as I said, so I'll just start walking through it. Section 1, as I said, is the same as the earlier draft you saw, 1.1. So in subdivision 1, you have an appropriation, $455,000 to the health department to fund 26 outreach or case management staff positions within the preferred provider network for the provision of services that increase the motivation of and engagement with individuals with substance use disorder and settings such as police barracks, shelters, social service organizations, and elsewhere in the community. And then as part of that subdivision 1 is language that it is the intent of the General Assembly that these positions shall be funded annually by the Opioid Abatement Special Fund unless and until the special fund does not have sufficient monies to fund this expenditure. That was matching language from last year's appropriation, not necessarily the appropriation amount, the dollar amount, the language. Next, you have an appropriation and you have two different amounts. So the amount in yellow, the 1.4 is the health department's. 1.75 is the advisory council. So this is an appropriation to the Department of Health for recovery residences certified by the Vermont Alliance for Recovery Residences. And again, you have this language. It is the intent of the General Assembly that recovery residences be funded annually at not less than fiscal year 27 levels, unless and until the special fund doesn't have enough funds in it. Next is, again, two different number amounts, 1.1 from the Advisory Council, 1.25 from the department, to the Department of Corrections to provide peer recovery center coaches in Vermont correctional facilities and probation and parole offices to provide group and individual coaching and reentry support. Next is $250,000 to DCF's OEO to support long-term programs at shelters for individuals experiencing homelessness, including harm reduction supports, transportation to recovery meetings and appointments, and clinical nursing programs. Subdivision 5, $200,000 to the Department of Health for distribution to the Vermont Alliance for Recovery Residences to provide initial entry fees and rent for individuals newly entering recovery housing. Subdivisions.
Next, stop you for 1 second.
Please. Yep.
Was 5 one of the ones that the health department asked to eliminate?
Yes,
Yeah, I was trying to sort out that cross measure.
but
Oh, no,
I can refer folks to my sheet.
Yeah.
It's all there. And you can see what each did. So if it's not, if the health department doesn't have recommended, they're not recommended.
I do believe their email may have referenced that, but I guess that's sort of our decision to make whether
yeah,
take it, so
Right.
it would still appear here until we make that decision to either agree or disagree with Department of Health recommendation, I guess is how I would.
there, okay. Right.
Keep going, okay. Subdivision 6, the request is 900,000 from the advisory council or 1.2 from the department to the department for the creation of new recovery resident beds that are NAR level 3 or higher. Subdivision 7, 248,000 to the Department of Health for the pre-hospital Vermont EMS buprenorphine treatment program to expand training for emergency service providers on carrying and administering buprenorphine after administering naloxone. Subdivision 8, 287,000 to DPS to expand the public safety enhancements team's harm reduction and strategic community intervention efforts and more Vermont communities. Subdivision 9, 35,000 to the department to subsidize room and board for individuals and Rutland Mental Health Services Transitional Housing Program. Subdivision 10, 288,935 to the department for distribution to Elevate Youth Services to support the creation of a low barrier drop-in teen center in Barry to provide food, activities, positive adult role models, peer counselors, prevention and recovery program, and direct connection to treatments. Subdivision 11, 128,999 to the Department of Health for distribution to the Greater Falls Connection to enhance youth engagement and education and to expand prevention-focused staffing and youth programming space in response to increasing community need. Subdivision 12, 200,000 to the Department of Health for distribution to Interaction Friends for Change to increase access to community-based therapy, housing, crisis, medical recovery, and employment supports for youth in Windham County. Subdivision 13, 237,646 to the Department for distribution to Springfield Project Action to support public safety enhancement team coordinator positions in Bennington, Springfield, Brattleboro, St. Jay, and Central Vermont for the purpose of providing administrative support, meeting facilitation, data tracking, outreach, event coordination, and sustainability planning. Subdivision 14, 300,000 to the Department of Health for distribution to VTAR and Recovery Partners of Vermont to establish new recovery residences in Brattleboro, Middlebury, Addison, Randolph, Chester, and St. Albans regions. Lastly, subdivision 15, 26,697 to the Department of Health for distribution to Winooski Partnership for Prevention to provide funding for staff time and stipends for partners to deliver medicine safety education to elementary aged youth during school school with family engagement. So those are the appropriations. I know you have some work to do on that section. The next 3 sections came from the health department. They're amending previous appropriations. So in 2023, you had an appropriation that was amended in 2024, and now it's being further amended. So that amount had been 1.5 divided equally between 4 opioid treatment programs. And the proposal is 1,056,000, getting rid of the language about equally between 4 opioid treatment programs to cover costs associated with partnering with other healthcare providers, to expand satellite locations for the dosing of medications, including costs associated with the satellite locations' physical facilities, staff time at the satellite locations, and staff time at opioid treatment programs to prepare medications and coordinate with satellite locations. And subdivision B, satellite locations established pursuant to the subdivision 1 shall be located in Addison and eastern or southern Vermont, and striking through the language and in a facility operated by DOC. In subdivision 2, 500,000 to establish a satellite location in northwestern Vermont, and removing language, a second clinic addiction treatment center. So that is the first one. Second one, this is amending an appropriation from 2023, appropriated 100,000, and now the new amount is 91,712.66 cents to implement a wound care telehealth consultation pilot program for the purpose of utilizing wound care experts to provide telehealth drop-in appointments to address syringe use by individuals with opioid use disorder. And the last of these is an amendment to a 25 appropriation, fiscal year 25 appropriation. And that would remove this 1 million appropriation of settlement of special fund monies for grants to providers to establish community-based stabilization beds for individuals transitioning between substance use disorder, residential treatment, and the recovery system. And then we have the bill taking effect July 1, 26.
Speedy.
Thank you. These letter sections, where did these requests come from? And Nolan, am I missing anything? Are they reflected on your sheet?
They're not, for the record, Nolan will look this questions. They're not reflected on my sheet because I was only focusing on the current recommendations and then showing if they had been done previously. The sheet does not show previous appropriations that are not being recommended. That makes sense. So if you had an old sheet from last year, you see there's a bunch of things that were on that sheet that are not being recommended this year. They don't show up on the sheet. Right. But what I'm gonna do is when I'm gonna update the sheet, that'll show the House Human Services recommendations. And I'll also add a reversion line. But I'm not gonna put everything that's ever passed because the sheet goes 10 pages.
Yeah. And so these are reversions,
There's a reversion.
and they are coming to us from the Department of Health. And then just an observation, I think one of these lines, maybe line 8, I'm sorry, section 8, page 3, line 3. The 287,000.
Mhm.
I think that is the Department of Health. So to request, so that would be page 3, line 3.
Oh,
That would be Nolan, on your sheet, it's number 8, Public Safety Enhancement Team, 287,000.
Yeah.
Department of Health, it just, for consistency in the document, it would be highlighted in.
Are they different?
it's only highlighted in yellow when there were two different competing amounts.
Oh, not
So
informing us that, okay.
Yeah,
if the amount is not highlighted, that means the OSAC and the Department of Health recommendations were the same.
or they,
Or
not
they had
necessarily,
different-
yeah,
One had the
one
recommendation.
had it and the other one didn't. Yeah, it's only when there's a conflict on a monetary piece
So
where,
this is really helpful.
Thank you.
Yeah.
What page language does, it has every recommended appropriation from both sides in there.
Yeah,
So it doesn't say there's a VDH or OSAC. The only time you would know if there's difference is there were two competing appropriations.
Right.
Okay,
Otherwise, it's the only place to know the difference between whether it's a VDH or an OSAC recommendation is the sheet.
that's right. That's it, yeah, which I printed much bigger. Okay. So I guess one question I have, and Eric, you might know the answer to this, is does the OSAC have any opinion on the reversions that were offered by the health department?
We didn't hear anything about that. So there was no opinion that could be provided.
Okay.
I have a rough one.
Yeah,
The other thing to keep in mind is because it has both appropriations from both of them, the number that's in the bill is not reflected in the sheet yet. It's much higher than both.
Right.
So you're gonna have
Yeah.
over probably $6+ million in recommendations. Be mindful about that and future balance. Again, what I will do is I can put together a sheet that has everything in it, because you can see what the line is and what factors in there.
So
Right.
talking about these reversions, I'm still not quite clear probably, but are those largely kind of bookkeeping corrections, or are they actually changes in programming that happened after the fact?
I actually don't know that.
So, yeah, for the record, Noel Manuel, great question. And I would say ask the health department to specify. A reversion is when we're trying to take money back into the previous appropriate.
Yeah.
What it does not say is why they want it.
Yeah.
And so I would recommend you write that question down. I mean, Jessica's
That's
here.
Rex, Debbie, go ahead. Brenda,
Muted.
you're muted. We can't hear you.
Can you hear me now?
We can.
I just want to make sure, is there anything in there for that safe injection site for Burlington?
There isn't currently, but we need to talk about it, so.
Okay, I'm
I will-
against it. I just want everybody
Okay.
to know. And I would like it maybe as an amendment or something so that I could vote on this section, because last year I had to vote on the entire bill because nobody would accept my amendment, which they could have still voted for it.
Well,
but-
currently, there's nothing in the bill right now, so when we have the discussion, we can.
It just puts me at a difficult situation because that's the only one thing I wouldn't vote on. And so it makes me look like I don't want to help. You know what I'm saying? Thank you.
Okay, so we need to get the health department. Jessica, go ahead.
Yes, Jessica Shimano, Policy Director, Department of Health. And for the version that is being requested for the MDU for Department of Corrections, that was no longer needed. And that because they were able
What
to
page is that on?
establish the medication dosing unit using existing systems of delivery instead of having a separate unit. So that's that 444,000 being reverted back into the fund for the DOC medication dosing unit. And then the Department of Health for the stabilization beds and re-engagement beds. In fiscal year 26, the department received base general fund appropriations for those. So we no longer need the $1 million from the opioid abatement special fund for that work. So those re-engagement beds are funded in base.
Can I ask, I'm not entirely clear where you're just gonna go through it again so I can be very clear. Section on page 6, section 4 is what you were just speaking about, I believe. Are we on the same?
Yes,
Yes.
page 6, section 4 is the reversion for the stabilization
Right.
beds. That is
Okay.
correct.
And then now the one before that, you mentioned something about $440,000. I don't see that
Yes.
anywhere. So
That one that starts on the bottom of page 4, section 14.
okay,
This is where we're talking about the medication dosing units.
okay,
And so the change in that amount from 1.5 million to 1.056 is that
I see. Okay,
$444,000
got it.
reversion.
Okay, good.
And then, just to be clear, there's another change in language in that section.
That's would be
Which there was 500,000 that was appropriated to establish another medication dosing unit satellite location in Chittenden County at Howard Center. And Howard Center has declined
Oh,
to
yes.
start that. So we are just requesting not a change in funding there, but just the change in language to allow the department to work with another partner to establish that MDU in northwestern Vermont.
Okay, so may I ask another question? Do I understand that the 500,000 that you're talking about for Chittenden, is that part of the 1,056,000?
Yes,
Okay.
correct. Yeah.
Just quickly,
Yeah.
my apologies because
Yeah,
they did
wasn't.
explain that when they did do a presentation in regards to. So me saying, no, I didn't hear anything.
Okay.
We are aware of it, yes.
Okay,
And just to put a finer point on that piece, in the letter from the committee, you will see those two reversions that I just spoke about, recommended by.
Oh, I see. They're also recommended.
Yeah.
Okay. And then, sorry, do you have anything to say about section 3 on page 5? Or it's actually section 3, section 14. That's,
That one is the home care program
And the-
reversion, and that one is a matter of bookkeeping. The project was concluded and there was 8,000 and change, or
okay,
9,000 and change left over, so that is just kind of sweeping it back in.
thank you. I'm going to take time for that.
okay, so that explains the revisions, and so did I hear that two of them, OSAP was fine, and one of them was a bookkeeping issue?
Yes.
So Jessica, page 5, line 8, that 500,000 is now, instead of going to Howard Center, is that the one that you said Howard Center declined? So then that's going somewhere else. And then that's it. Okay, so that takes care of the revisions.
Can I ask you a question on that 500?
Yes.
Has the department been able to identify a potential partner at this point? Presumably they're outside of Chittenden County if this language is seeking to broaden it.
Well, Jessica Chapano, Department of Health, we have been engaging with potential vendors for this, and we kind of need to cast as wide a net as we can for this because they intend to operate it in Chittenden County, but they need a larger geographic area operations as well. So, so we, I think this gives us the most flexibility in trying to procure another vendor for this project.
It doesn't change the department's understanding of the need.
Correct. Correct.
Okay.
Rocksteady, do you have a question?
I do. I'm just curious, how can we as a committee commit money when we don't even know where it's going? That's kind of like not responsible.
Well, they typically put an RFP out and get different vendors. The state has a process to allocate the money to the organizations that apply for the funding. So that's pretty normal, standard process for money that we appropriate.
I know, but are we being asked to vote on this without knowing today?
Nolan, go ahead.
Oh,
Correct.
no
Nolan.
vote today, not till we know.
Nolan is answering your question, Brenda.
Okay,
The record, no manual joint fiscal office, we very often will appropriate money to a department or an agency, say, please find a vendor, please find a contractor. We don't generally get involved in that level of contracting. We can often sometimes we often know or hope or be specific because it's going to Howard or this or that, but generally we don't. Where the legislature gets more involved is in the oversight.
now I can see why we have issues. Thank you.
Welcome. Zan, did you have something?
No.
Okay. Go ahead, Anna.
No, I was just gonna add to that, but we are appropriating it for a very specific purpose. So we're not just sending it out for whatever. It is being appropriated to a department that then has to spend it on what we are directing. So it's going to a department that has to supervise it. It's not just going out to an unknown entity.
And then on page 6, I'm sorry, you guys talked about this, but I just want to make sure, the 1 million reversion, for community-based stabilization beds. What was the reason for that?
Share Justice Department, Department of Health. In FY 26, the department received base funding for re-engagement beds or stabilization beds, as it was referred to in this language. So given that we received the base funding, we don't need the additional funding from the special fund to support that. And we have the re-engagement beds up and running, I think, as of July this year, so.
Go ahead, Anne.
Is there, not sure how to articulate that. Is there a reason for having it in one or the other? The base fund versus out of this fund? Is there an advantage?
Yeah, in the base fund, it will continue and we won't have to use special fund money every year to support that. So for these projects that are working and are necessary, it is preferable to have that in base funding. And as you've heard, I think, in testimony to this committee on the opioid abatement special fund, these funds are limited over time. And so this is part of also the department and administration's approach to finding sustainable funding for these important projects versus continuing to fund them out of the special fund.
This makes it sustainable.
It
makes it sustainable.
It makes me wonder when we're in a year where we are highly fiscally stressed, maybe using a special fund is the right way to keep something going and then getting it back in the base when our capacity base is greater so that we can preserve base funding for things that otherwise would be eliminated. That's where the question was coming from.
Any other questions for the department on the reversions?
And it's up to you.
They just said this to post up here today. Great. Thank you. Okay, so I will also put out that we have had a request for the overdose prevention site, which was not part of the application process to the OSAC so this was not in any recommendations that we received. And the long story long is that we funded the OPC several years ago and have appropriated $1.1 million every year for the last 2 years. And they were a little bit stalled in getting going. So they have now partnered with a community organization and work has begun and are now asking for some either language or money to be appropriated because they're anticipating opening in 2026 and spending that 2.2 million. And they have concerns that they will not have operating money when they open if they're left out of the recommendations for 27. So just gonna put that out for discussion for folks to kind of think about and that's.
Thank you. I guess personally, I'd like to see one pager, whatever it may be, from them to set forth the expenditures of the $2 million, 2.2, how much of that is in fact gone, how much of it may be left within this year before we take another crack at this a year from now. So,
Ask and you shall receive.
Yeah.
and I guess, yeah, the budget for the balance until we're at this again next year.
Yeah, so I have both of those things. I don't know if I have them electronically yet. Aiden, do I have them
Not the
electronically?
spreadsheet, the memo you have electronically, not the spreadsheet.
Okay, so I will send the memo to the committee. And I can pass this around for folks and then maybe Aiden, if we can get this electronic, no,
Maybe, we would have to talk about getting.
Okay.
I feel like.
We just make copies.
I guess high level, seems like we'd be making a decision unless we make fairly significant cuts in what's been proposed to us by the department or the advisory council. We would be making a decision to be depleting the balance by including it at this point. It's just an observation, not at this point an opinion, one way or the other, but that would be the reality.
um, any other considerations? I agree. I feel like, part of the conversation has been, and others might remember differently when you were here, Dan, when we passed this, and Jubilee, you were here as well. I think that the legislative intent was not for Burlington to purchase a building. We had envisioned that they would lease a building. It turns out, and this makes perfect sense, that it is really difficult to lease space for this purpose. So they have spent a lot of time. Insurance is difficult. Landlords just aren't agreeable. So the organization has now identified a building that they can purchase. And I think all in, it's gonna be about $1 million for the building and what's needed to renovate it, to get it to be viable for this purpose. Rep Steady, go ahead.
I agree with Rep Bishop on this one. And are you going to decrease somebody else to do this? Like, that would be the right way because they've already presented it with the dollar figure. And if they purchase a building, is it going to be in the state's name? Because when this isn't going to last forever because most of the other states have already stopped it. Who's going to own that building? Burlington on the taxpayer dollars?
All good points.
Yeah. So we would have to see what the lease of the building says. If it says something that the money from the sale of that the building has to be sold, if this program is no longer going to be in effect, if the building's sold and the money goes back to us, the state. So there would be a lot of homework to do on that one if they purchased the building with our taxpayer dollars.
All good points. Thanks.
Thank
Brenda.
you. Thank you.
So we're gonna have to do more work on this piece. Another option is to, and Katie, I don't know how this would work, could we, or Nolan, like, could we put language that would maybe authorize them to have more money if they needed it?
It sounds like a budget adjustment, kind of.
Yeah, I think you either give them the money or you don't. And give them the money. The health department wouldn't, or whoever, you've appropriated the health department wouldn't give them the money until they purchase that would be part of their contracting, I guess. And if they don't buy the building, then it'd be, yeah, you can put it back in. I guess my point is, I don't think we need to get that level of detail in the words. You talk more.
So this is obviously very like late evolving. This was just starting, came to our attention like last couple of days.
But the thing is, that this is what happened last year.
What happened last year, so.
Yeah.
You know, last minute, it was,
I think we told them last year, don't. Not last minute.
And I don't remember, did we include it in our recommendations last year or did,
Adjusting things to.
I believe appropriations.
but appropriations
Yes.
brought them back up to the
Yes.
1.1 million.
Right.
Oh.
Yeah, so they've received the full funding for the last 2 years.
And what's been expenditure, Nolan, do that? Is it still at the,
In their letter.
It's in their memo
In their
here.
memo, they talk about how much.
Expenditures to date, right, there we go. Looks like it.
They have a total they have a total award of 2.2 million, of which they've spent 781,000. They've given some of that to the subrecipient.
Like obligated funds left 1.4
For,
million.
And they're estimating that the cost, if they were to purchase, they said, did I hear $1 million?
Yeah, they have, it's like,
I don't see that.
it's like
anywhere.
$600,000 for the building and then
more money.
another 400,000 or 500,000 to kind of put it up for the
Oh, I see, here
purpose.
we go.
Was in their original budget for space.
Well, their full allocation is a 1.1 annually. And that's for operations and lease and training and staff, everything. I mean, when I had a chance to look at this a little bit before you guys quickly, but some of the money that is budgeted that they already have looks like it could be like operations money. Yes, go ahead.
My recommendation to the committee would be, rather than debate it now,
Yeah,
get asked OPCs, or we can do it ourselves, break down their ask by one time and ongoing one time, because everything's one time.
yeah,
But there's real one time.
Yeah.
Like, just like, then what their ongoing one time is, because if they're gonna continue to be funded year after year on this, what happens when the money runs out? How are they gonna sustain it? And they own a building, so think about, so that's how I would think about it, is what's the one time and what's the multiple one time? And then think about it in the whole, like, bigger approach of it, not just in an hour bus of 1 year.
I like that recommendation.
So I don't know if we wanna ask
So,
them to put
yeah.
together something. We are asking them to put together, like, what's your one time for, and then what's your ongoing yearly anticipated asks? And then we'll know next year what they're gonna be asking for.
That's a good plan.
Yeah,
Thank you, Nolan. Go ahead, Tom.
Why can't we buy this building with the opioid fund money?
I'm sorry.
Why can't we buy this building with the opioid fund money?
Well, that's what's being proposed. This is all talking about, everything we're talking about right now is opioid settlement money. So that's what is being proposed. We're not using general fund dollars for this.
That'd be good, because if things do fall apart, money can go back into the fund.
Well,
I'm thinking.
Well, that's a question, kind of.
If they don't, they can write on.
Yeah, we could do
Reversion,
that.
yes.
We could, it could be reverted.
Vice Chair.
Yes.
If I could confirm my understanding, is when the legislature first passed this bill or language related to putting this into one fund, there were 4 primary focuses for how the money would be spent, one of which was the center. The Burlington Center was one of 4 things that were sort of selected. Am I?
Are you thinking about last year's opioid bill where the first 4 items said that it was the intention to continue funding those items? Is that what you're thinking about?
It may be. Was that something new as of last year?
Yeah,
yeah.
Okay.
Developed over time.
So we are not necessarily,
you're not bound. I think it was intent language. It's the same language that is in B, 1B, 2B, right?
Or not to.
so one,
so if I can jump in, right, Christian, is the bill always is one-time funding.
Right.
And so they add the intent because they want to remind themselves, yourselves, of what your priorities are.
So I have another,
I'm sorry,
Go
before
ahead.
we leave this point, can you reference again where you're directing me in the
Yep.
language?
So if you look at section 1, subdivision 1B, there's this language that says it's the intent of the General Assembly that these positions shall be funded annually. In last year's opioid bill or opioid abatement special fund bill, the first 4 subdivisions had language like that says it's our intent to continue funding these specific purposes. So I'm wondering if that is what you're thinking about.
Among those 4 was this site.
Mm,
I can,
is it not?
I don't remember it being there.
for some reason, I thought recovery residences, there were 4 things, including recovery residences, and I thought one of the 4 was.
Let's see.
all right.
Because we didn't know if it was actually gonna be.
I think we wouldn't have included it last year.
Right, because we didn't know if it was gonna get there or not. It was very uncertain even last year. And now, I mean, they're going through with aspects of it, not with the original at this phase, right?
Or they needed to do certain activities on site before doing the safe injections.
Right.
But I think, and so this.
They're not
into that
doing the
stage.
safe injection site piece of it yet.
That's what I recall, but that's what I think,
yeah.
This,
Go
yeah.
ahead, Katie.
Last year's Act 16, you have the 1.1 to the Department of Health for the purpose of awarding grants to the city of Burlington for establishing overdose prevention, et cetera. Then in that corresponding subdivision B, it is the intent of the General Assembly to continue to appropriate funds from the opioid abatement settlement fund through fiscal year 28 for the purpose of awarding grants to the city of Burlington for the operation of the overdose prevention center, unless and until the special fund does not have sufficient monies to fund this expenditure.
So 328.
28.
So I have another clarifying question, because I think in the original legislation, didn't we call the OPC a pilot?
Mhm.
I would have to pull that up. That would be the first year that any money was appropriated
Yeah.
from it. Let me take
So
a
I
look.
just remember us talking about a pilot program, so that's my other question, is if we're buying a building, how does that kind of jive with a pilot program that may not reach?
And that language, to say one more thing, that language from last year probably explains why they didn't make an application, because the intent is there, and so they probably.
Yeah, but we do that.
Yeah, but other things that were in that intent language, people apply.
They apply.
I know others did,
Right,
just suggesting that
Yeah.
perhaps, it might be.
yeah, that could be an explanation.
I believe that was the language in Act 70, is it Act 73 from 2023? That it was languaged as a pilot.
Right, so we could go back and look at that language.
Hold on.
I think we fund,
It was 72, Act 178.
That was close.
72.
178, in which year?
Yeah, it was actually 2.3.
22?
I would think that we,
Of 23.
we fund.
That was the first year.
With the hope that they'll be successful, I would assume. So I guess one of the points I'm driving at and asking the questions that I am about what language have we included in the past about our intentions? Again, that's intent. We're not bound by it. But if it was part of the act,
This is from 20.
I think it requires special scrutiny. If we had expressed a past intent, we should be giving it a fair airing. Doesn't mean we're going to include the funds. But also recognizing, I think this was probably the most controversial part of the bill. So again, it requires more attention than we can give to it today for sure.
Yeah.
Like it.
So we need to hear more from Burlington and the partner organization about the details that Nolan so elegantly put out. Thank you, Nolan. And do folks are folks okay with the reversions? Can we put that to bed?
Yes.
Yes.
Anne might have it. Okay, I think we're okay with the reversions. So we need to continue work on determining the discrepancies in programs and discrepancies in the amounts.
Ask a question about one of the asks.
Yes.
Thank you. The department included $250,000 for emergency shelters, line 4 on Nolan's chart. Sustaining services to meet the need of guests in emergency shelters for transportation. I'm trying to determine whether there's any interplay with DCF's housing initiative, as they've called it in the budget book, and regarding OEO hub funding for substance use recovery sheltering options. And there's 1.2 million there. I'm just not sure if they're talking about the same shelters or these are a broader set of shelters that they need the $250,000 for to ensure services are provided.
Can we get some clarity from DCF on that question?
It says that it's administered via an MOU with VDH and OEO. Would there be any VDH information on that?
I mean, I'll defer to DCF. so.
Okay.
The other thing to keep in mind, if you look at the notes, it said funds would only be used for services and supplies not otherwise eligible for Medicaid funded other state sources. So it's probably helping to supplement what they're doing over there. But in areas where they are falling short of things.
So we have a couple minutes left. Can we just go through the spreadsheet, at least the ones where the recommendation from OSAC and the health department were the same? Say whether we agree with that recommendation or not. So the first one is the outreach and engagement staff at all preferred providers. That's 455,000. It's an existing initiative. And that is being recommended by both entities. Looks okay with that. Yes. So Katie, that one's a check.
Okay.
So I think that's the only thing that.
There's one at number
Prevent.
7. On the, on Nolan's sheet.
Okay, so prevent program VDH. So one thing to keep in mind is the 5 on top have been existing programs. And everything past number 6 is new funding. So these are probably new programs. And given that this is one-time funding and limited time and amounts, keep that in mind, right? So like what happens in a few years when we run out of money? Can these programs sustain their operations without the support of the opioid settlement money? Go ahead.
Yeah, and along with what you're saying right there, didn't we have a conversation earlier about this notion that perhaps we might want to consider at this point funding only the ongoing projects and not actually starting new ones, just because in keeping in mind what how the sustainability of the fund itself. So that's just something else to keep in mind. If we haven't even had that conversation about what we think about that idea, trying to persist or extend the life of the fund overall, as opposed to just spending the money. I don't know, so.
An observation I would share, just the way I've been thinking about it, is that the department, BDH and partners have sketched out, I think, a vision for recovery residences that includes the funds here, the funds that we're spending at GF, funds that we're looking to spend from the rural health transformation.
That's fine.
So I have an inclination as I look at the differing amounts and the categories to go with VDH recommendations with respect to recovery residences, only because I think they have built it into a larger strategy. And they have a more complete window into those goals than perhaps the advisory council had access to. And things have been evolving. Things have been evolving with World Health Transformation Funds and Vision in particular that the advisory council didn't have.
Just the picture.
So are you specifically talking about number 2 and the,
Well, I think it's a grouping of 2, 3,
and 5?
Uh,
5, they didn't make any recommendations there.
they didn't make a recommendation, but where the amounts differ, 2, 3,
6.
6. And I think 14 they spoke to in their letter as well. Again, about a vision that they have, and it's not to leave out those communities, but it's part of a bigger vision. So that's just a viewpoint that may help move some of these along. I'll say that we did reference number 5, the scholarships. I don't know that what we received yesterday spoke specifically to that request. Whether the department spoke to that request or not.
So some of the testimony we heard this morning referenced that.
It
the
did, and I found
scholarships.
some of that moving.
What's that?
I said, and I found that
Yeah.
persuasive.
That's
why I hold that one aside a little bit from what I said.
And also the notion that if the I don't know the right acronym, but the new money that we're finding, if it's available in some ways for this, wouldn't it just, and we don't have clarity about that yet. We have probable, Doug's suggesting probable insight. There's insight probably, but it seems like we're moving too fast on this in a certain way. If there are ways we could use that money now or for the next 5 years.
like the rural health.
Yeah, it seems like we
Yeah.
would want to be able to use that money now and maybe let this money either use it for slightly different purposes or not use it at all.
Well, the health
Years.
department made some recommendations around, which I sent to everybody about shifting and.
Well, I'm sorry. but
No,
I-
that's okay. So that's another piece of the conversation.
Yeah.
Was that you, or were you referencing Teresa's email of yesterday afternoon at 1?
Yeah.
Yeah.
Uh,
And in that, it actually does suggest that we do not follow OSAC's recommendation with respect to the scholarships because they thought they would use rural health transformation dollars.
Right.
I think the timeline for using those funds may be a little bit later. That may be one that we sort of consider splitting to get through the first half of the fiscal
Yeah.
year.
How do folks feel about Doug's opinion about the recovery residences and the grouping of, so I'm in agreement with taking VH's recommendations for number 2, 3.
Are the numbers,
Yeah, I'm
Same.
looking at the spreadsheet, yeah.
so number 3 is peer recovery services in corrections?
Yeah, so the health department is recommending slightly higher amount than OSAC did. Same with number 2. Number 2, the department is recommending a lower amount than OSAC did. And I'm in agreement that we follow the department's recommendation.
Okay, I thought we were talking about residents, the recovery residences, and that's recovery services. That's,
Yeah, well,
if
I
you're
think
bundling
it's
them
all
together,
bundling
that's
them.
fine.
Oh,
Okay,
Yeah,
all right.
all the supports
Yep.
for the recovery residences.
Yeah.
So we are good with number 2 with the health department's recommendations?
I'm not good with that. Based on the testimony we heard this morning, we really heard that this would harm our recovery residences and their ability to build out. And we're asking us to go with a full recommendation as by the committee. And I just, yeah, I think that deserves more of a conversation. And yeah, sorry, I'm very sick, but so having trouble articulating. But that is one. I'm fine with number 3. But number 2, the reduction in funds to support recovery residents is just not something I would agree with.
There's too many
We can put
numbers.
it in that because it's moving elsewhere versus
This
not
is not
being funded.
moving
No, this is
elsewhere.
not, okay.
This is just the department is recommending a lower
Less.
amount of money.
And
Yeah.
I guess in the context, Jubilee, I was putting it in the context of additional funds that weren't necessarily part of the conversation within the abatement special funds, and that is rural health transformation and an increase to base this year, that I do think the VDH and the state share the goals of expanding the residences that the advisory council has with respect to putting the 1.75. So I guess I'm not feeling as concerned as I think I'm hearing from you that it's not going to allow the building out of additional assets.
I think we've run into that same thing you raised, though, of the rollout of those funds, and are we blocking progress in the meantime? I don't know. I would like to have a chance to connect with the recovery partners and hear from them, I guess. So I just don't feel like I can vote on this one. And if I did, it's to not support it right now.
About this.
Yes.
Nolan, go ahead. Brenda, I see your hand. I'll get to
I
you.
just want to flag that, we're talking about the existing program. I would also refer you to the sheet in the VDH report that talks about unobligated versus obligated. So for recovery residences, there's still another 140,000 that has not been obligated. So there is money potentially still sitting there. So when you think about how much more money you're going to give them, think about also there's still money that you have appropriated for this that hasn't gone to this first process. So there's that money. The other option you have is you don't have to go with either recommendation. You can pick a number in the middle.
So I'm just refreshing my memory on the letter, and I mean, we're grappling around with how is this recovery housing being addressed in different funds? And what the Department of Health is saying is it won't be ready by the end of the week, but they are presenting they are going to present a full budget for RHD recovery housing to the committee. It just won't be ready by the end of this
Yeah.
week, which is our timeline
Target
issue.
for this.
But they are planning to present that whole vision of how this all fills in, and unfortunately, we don't have it yet.
Brenda, go ahead.
I have to head out because it takes me over an hour to get there from Milton. But I just wanted to give my 2 cents. When you mentioned the new requests, my past practice as a select board member, school board member, these places will still want to exist. And I have a feeling they'll be coming asking for property tax, the taxpayer monies in the future. So I'd be very careful about voting for those, because I've seen it happen in school systems. That's why we're in the mess we're in with grants. And then they keep the people, the money from COVID, they kept the people, and now we're all struggling paying our taxes. So I'm heading out, and I wanted to just put in my 2 cents, and I'll see you guys in an hour.
Okay. Drive careful.
Thank you.
All right, it is noon. Katie, thank you. I appreciate you being here. We can go off live and we'll pick this up. I don't know when next, but soon. Because we have a deadline.
You what?
And we have a joint